Hi, I'm Amy Wilhelmi. Welcome to Healing is a Messy Bitch. Today we are talking about the question that every integrative clinician asks, usually late at night while replaying sessions in their head. Am I doing this in the right way? Am I doing this in the right order? Not, is this modality evidence-based? Not, did I get trained in this? But is this the right intervention to do right now for this nervous system? Because here's the thing that no one tells you in training. Trauma doesn't care how many tools that you have, and clients don't come in with an issue that's neatly labeled. They come in with attachment wounds, dissociation, sexual shutdown, panic, grief, relational patterns that all light up at the same time. And when we get excited because we finally have all the good tools, we've taken all the trainings, we can actually turn therapy into this endurance sport. We have so many tools to choose from. How do we figure out which one to use? So sequencing isn't about being fancy and having all the training. It's actually about being ethical. The nervous system always comes first. Always. If a client can't stay present, nothing else works. Not EMDR, not ketamine, not couples work, not sex therapy. If the body is overwhelmed and the brain is offline, and if the attachment system feels unsafe, insight turns into threat. And so when I think about sequencing, I'm not asking, what do I do next? I'm pausing and I'm asking, what can this system hold next? Okay, I'm noticing the client. I'm noticing what's happening with them. Sometimes that means starting with emotionally focused therapy because attachment safety is really the foundation for everything else. Sometimes it means slowing down and doing body literacy before touching the trauma. Sometimes it means preparing for ketamine very carefully, not because ketamine is magic, but because it opens things. And sometimes it means not doing EMDR yet, even when the target is obvious and even when the client wants it, because wanting relief is not the same thing as being resourced enough to process or handle it. So here's the sequencing map that I use. And it's not a protocol, it's a compass. First, safety and stabilization. That's nervous system regulation and relational trust. That's EFT, psychoeducation, consistent pacing. Second, increasing flexibility. That might be ketamine. That might be gentle emotional access. That might be helping a client feel something without flooding. And then the third is trauma processing. That's where EMDR shines, when the client can stay present enough to integrate memory instead of relive it. And finally, embodiment and sexual healing, because trauma recovery isn't complete if the body is still off limits. Sex therapy is an extra credit. It's where healing becomes lived. The biggest mistake I see clinicians make is confusing intensity with progress, pushing clients through something that maybe they're not ready for. More emotion does not mean more healing. More sensation does not mean safety. And sometimes the most ethical move is slowing the hell down. Same symptoms don't mean same sequencing. Two clients with low desire may need completely different starting points. And if you're ever unsure, that's not incompetence, that's wisdom. Integration isn't about doing everything, it's about doing what the nervous system can tolerate next. Healing is a messy bitch, but pacing is how we keep it from becoming harmful. Join us next time. Thank you.